friends, I am Damini Gupta. Today we will be talking about stroke and the role of physiotherapy in stroke. What is stroke, sir?
Stroke is a sudden acute severe manifestation of cerebrovascular accident. It's mainly because of the pathology is related to the blood vessels, which is present in the brain. Okay, so it is a damage to the blood vessel. So the blood circulation to the brain is by means of circle of Willis. Okay, so mainly there are chances for atherosclerosis, narrowing of the blood vessel, and sometimes it leads to sclerosis. Okay, and it sometimes causes the formation of platelet plug aggregation in the blood vessels that leads to ischemic changes in the brain. So most of the strokes are 80% of the strokes are ischemic strokes, and 20% of the strokes are hemorrhagic strokes. Okay, the prognosis will be good in case of ischemic stroke. So nearly 60% of the people who have this ischemic stroke, they have warning signs called as a transient ischemic attack. Okay, it will automatically resolve by itself in 24 hours. And in ischemic stroke is mainly because of risk factors like obesity, hyperlipidemia, and cigarette smoking, alcoholic, so chronic alcohol. All these are risk factors for the obesity is one reason, and blood pressure also. These are the risk factors for the development of ischemic stroke. So the hemorrhagic stroke, it may be because of aneurysm, arteriovenous malformation, aneurysm, okay, subarachnoid hemorrhages and all. So the role of physiotherapy here, the first the patient have two stages, and one is a acute stage, is a flaccid stage. There is no movement at all. Okay, we don't know when the patient will move from flaccid stage to spasticity stage. So in the flaccid stage, the role of physiotherapy is the first we'll go with electrical stimulation to facilitate the tone in the muscle. Then we'll go with the tapping of the muscle. We'll go with the quick icing from distal to proximal to facilitate the tone, and we go with the joint approximation technique and quick passing movements to facilitate the tone in the muscle. Okay, so in the flaccid stage, we go with the Bobart technique, active assisted exercises using of uninvolved limb, and bed mobilities, bed transfers we have to teach, and in that flaccid stage, pelvic bridging plays a major role here, because pelvic bridging leads to posterior tilting of pelvis. Okay. So one more important thing is in once the patient has developed the spasticity, spasticity is a velocity dependent tonic structure reflex. Okay, so once the patient develops spasticity, electrical stimulation we have to go to antagonist group of muscle. So differentiating from the spasticity to rigidity, spasticity one group of muscle gets affected. In case of rigidity, both the group of muscles get affected. This is the differentiation. So once this patient has developed this spasticity, we have to stimulate the antagonist group of muscles, and deep transverse flexion at the point of insertion of the tendon will help in reducing the spasticity, and active resisted exercise for the opposite group of muscles, and weight bearing will help in reducing the spasticity. So once the spasticity has come down, first we have to promote, in flaccid stage we have to develop the tone in the muscle. Later we have to increase the tone. Later we have to concentrate on decreasing the tone. Okay. So and functional activities. So nowadays in recent evidences and all, we have got a robotic hand. So the hand movement and finger movements will be there with a particular frequency. So automatically when you do particular activity with a particular frequency, the brain will register that. The improvement will be throughout the new neuronal networks and the neural plasticity will be there throughout the lifetime. It is not like 6 months is very important, but 2 years are very important. After once they have come to the rehabilitation centers, okay, if you consistently work for 2 hours on the rehab patients, rehab clients and all, for 3 weeks, so there is a lot of improvement, and the prognosis also depends upon the extent of lesion and the location of the lesion. This also plays a major role. So physiotherapy play a major role, and the left Broca's area and Bendix area is a speech center which is located in the left parietal of the brain. So speech therapist will also play a major role here. Okay, occupational therapy will also play a major role here, but to develop the fine motor movements and gross motor movements in the hands and all. So all the people, therapists grouped together form a multidisciplinary approach like a physiotherapy, occupational therapy, and a speech therapist, along with the physiotherapist and orthotist. They play a major role here in the better outcome of the rehabilitation. Here in Revive Physiotherapy Rehabilitation, we are providing such an advanced physiotherapy therapeutic techniques for the better outcome of the patients. Thank you.